Hello friends, today we are going to discuss here about orthopedic MCQs. These are very high yield. In transverse fracture of the patella, what is the treatment? Excision of small fragment, wire fixation, plaster cylinder or patelectomy. So guys, which one is the single best answer? This is very high yield. So for fracture of patella, we use wire fixation. Now, commonest type of dislocation of hip is anterior, posterior, central dislocation with fracture of shaft. This MCQ is also important. So if you know the answer, no need to think about such MCQs. These are one-liners. Answer is posterior. Posterior type dislocation of hip is commonest. Now, March fracture affects multiple times. So many exam they ask this MCQ. Neck of second metatarsal, neck of first metatarsal, body of second metatarsal, neck of first metatarsal, or fracture of lower end of tibia. This is very simple. Neck of second metatarsal involvement. Now, commonest complication of extracapsular fracture of neck of femur is non-union, ischemic necrosis, malunion, or so all options in front of you. So guys, here the best answer is malunion. Malunion is the commonest complication of extracapsular fracture neck of femur. Now, drugs causing congenital defects of fetus in pregnancy, except they are asking. Lithium causes what? Abstinence anomaly. Thalidomide causes phacomelia or absence of limbs. Tetracycline causes fetus congenital defects, but sulfonamide not causes. So answer here is sulfonamide. Okay. Now, blood coagulation profile in pregnancy is increase in fibrinogen level of 10 to 25%, decrease in factor 10, 11, 12, decrease in plasminogen activity, increase in platelet count. So what happen in pregnancy with coagulation profile? So answer is increase in fibrinogen levels of 10 to 25%. These are most frequently asked MCQs. In classical caesarean section, more chances of rupture of uterus is in upper uterine segment, lower uterine segment, uterocervical junction, posterior uterine segment. So guys, please think before answering the question. So best answer here is upper uterine segment has a more chances of rupture of uterus. Now, only indication for internal version nowadays is bro presentation, face presentation, second fetus of twins, or breech. Very simple answer, one liner answer. This is second fetus of twin. Okay. Now, internal fixation is done in all fracture except compound, multiple, elderly person. So internal fixation we are not going to perform in which case of fracture? That is compound fracture. Okay. Now, myositis ossificans is commonly seen at the joint. Which joint? Hip, knee, elbow, shoulder. Which one? Guys, reverse this and look like what is knee. Remember this trick. Myositis ossificans commonly seen at knee joint. The most important factor in fracture healing is gold standard MCQ. Good alignment, organization of blood clot, accurate reduction and 100% apposition of fracture fragments, immobilization, adequate calcium intake. So the most important factor in fracture healing is immobilization, guys. Immobilization. Okay. Now, most preferred treatment of fracture of neck of femur in person is hem arthroplasty, total hip treatment, conservative treatment, closed reduction and internal fixation. So answer this MCQ answer you have to write in comment section. Then I am going to write you which one is the correct answer here. Okay. Lisfranc dislocation is tarso-metatarsal dislocation, lunate dislocation, scaphoid dislocation, posterior dislocation of elbow. So Lisfranc dislocation is tarso-metatarsal dislocation. Tarso-metatarsal dislocation. And here answer is closed reduction and internal fixation, guys. Now, carpal bone, which fracture commonly seen? Scaphoid, lunate, hamate, pisiform. In carpal bone or outstretched hand fracture, that is considered as scaphoid. Scaphoid, so many MCQs from the scaphoid they like to ask. Okay, so Lisfranc dislocation is true about clavicular fracture. Lisfranc dislocation is maybe due to scaphoid dislocation, but A or C, write in comment section which one is the right. Here carpal bone fracture most common is scaphoid, 100%. True about clavicular fracture is most common at medial 1/3 and 2/3. Communicated fracture common. Malunion occurs usually due to fall on elbow. So clavicular fracture is malunion occurs. Okay, malunion occurs. Commonest site of fracture of scaphoid, very important. Waist, proximal third, distal third, tuberculosis. So answer is commonest site is waist. Okay, commonest site is waist. So guys, thank you. Have a good day. If you like this video, put like on it. If somebody is new on my channel, please subscribe it. And if you have any suggestion, write in comment section. Thank you.